Simvastatin is one of the most common prescribed medications for cholesterol, and in today's video we're going to go over the most common side effects that can happen with this medication, as well as some less common ones that you need to be aware of before starting. Hi everybody, I'm Dr. Eric Richardson, a board-certified family practice physician. I'd like to welcome you to Family Med, a channel that focuses on giving you practical and accurate medical information to help you and your family. If you think this will be something that's helpful to you, make sure you subscribe, hit that notification button, and follow along with us. Today, we're going to be talking about one of the most common medications that we use to treat high cholesterol called Simvastatin. This is a medication that's been available in the United States since 1992 and was originally released under the name Zocor. It belongs to the class of medications called HMG-CoA reductase inhibitors, or more commonly referred to as statins. They work by inhibiting a part of an enzyme process which your body uses in the production of cholesterol. When you stop that process, you produce less cholesterol, so your levels go down. That's a simplistic explanation, but it's a lot more complicated than that. Overall though, it is felt that Simvastatin and the statin medications in general work on helping preventing and stabilizing plaques that can form. If those plaques get large enough, they can either block the blood vessels or become weak, rupture, causing an acute heart attack or stroke. Your doctor probably recommended that you take this medication because they felt that because of either your health conditions, such as a prior heart attack or stroke or even diabetes, or because of the level of your cholesterol, they felt that you needed some extra help in decreasing this risk. Taking cholesterol medications, of course, isn't the only thing that you should do to decrease your risk. The most important things, like making diet and lifestyle changes as well as stopping smoking, we're not going to get into in this video, but that doesn't lessen the importance of working on making these changes. No matter what we prescribe, if you're not working on those changes, you aren't going to find the benefits that you're looking for. So what do you need to know about this medication? Well, first of all, it comes in a tablet of 5, 10, 20, 40, and even 80 milligrams. It's meant to be taken once a day with a top effective dose of 80 milligrams. Most cholesterol production happens at night, so it seems to work better if you take it in the evening. An important thing to remember about this medication specifically, and cholesterol medications in general, is that it only works while you're taking it. I have people that come in all the time with their cholesterol high after we originally had it controlled, telling me that they stopped it because we fixed it. Well, unfortunately, this is not the way it works. Unless you have some underlying lifestyle issues that are causing your high cholesterol and you fix those, you need to stay on this medication. Don't stop them unless you discuss it with your doctor. Simvastatin is a great choice of cholesterol medications because most people do really well with it without any significant side effects. That being said, any medication has a potential for side effects, and Simvastatin is no different. Just like any other medication you take, if you look at the package insert where they list all the different side effects, you'll read a long list. For Simvastatin, they list symptoms such as upper respiratory infection, headaches, abdominal pain, constipation, urinary tract infections, nausea, heartburn, insomnia, and some mild liver elevations. I would say that these are fairly uncommon in general, but certainly possible. In my experience though, as well as what we have seen in many of the studies, the most common reason we see people not tolerate being on Simvastatin is because some type of muscle or joint pain. These can be feeling of muscle aches, similar to what you may feel when you get sick with the flu, or some muscle cramps or even weakness. This is still not common, but if there's something that is going to bother a patient, this is the most common one that we see. It doesn't necessarily mean that there's a significant issue or there's something dangerous going on. However, there is a condition where severe pain could point to something more concerning, but I'll get to that in a minute. Usually, all we do is have you stop the medication and the symptoms go away. And some who we really feel need to be on this medication will switch you to a different one in the same class, and usually they're able to do better. There are some people, however, that they just can't tolerate taking any of them, so it's not worth it for them to be on it. If you're having these kind of symptoms, make sure you work with your doctor to find out what is best for you. Now, there are other rare side effects you need to be aware of and watch out for. The first one is a condition called rhabdomyolysis. This is a condition where you get a breakdown of the muscles that sends byproducts to the kidneys, causing kidney damage or even failure. This is very uncommon, but if you have severe muscle pains while you're taking this medication, then get to your doctor, get some blood work, and have this evaluated. Now, some other more serious reactions can include liver toxicity, allergic reactions, pancreatitis, changes to your blood counts, including certain anemias, and a decreased white blood cell production. These aren't common, but they can be monitored by your doctor while you take this medication. Now, there are some conditions that we need to talk about that being on these medications long term can possibly put you at risk for. There have been some concerns regarding the use of statins and its effect on memory and dementia. There have been reports of memory changes while being on this medication as well as others in the same class. Now, larger studies looking at this haven't found a significant correlation between the two, but it doesn't mean that it can't happen. If you notice memory changes upon starting this medication, it'd be worth talking to your doctor about. Some have seen that this may be more common in medications that we call our fat-bound medications, like atorvastatin and simvastatin. Switching to one of the other more water-bound statins, like rosuvastatin or pravastatin, may be helpful. This is definitely a discussion you should have with your own doctor if you notice any issues. Now, it's important to understand, though, that this hasn't been found to cause actual dementia. Studies looking at the effect of dementia have actually shown some role in the prevention of this happening. Okay, now another area that needs to be discussed is the risk that statins may play in the development of diabetes. Large studies looking at this have shown that there may be a small increased risk of developing diabetes while taking these types of medications. This risk appears to increase the higher the dose that you're taking. The risk is small, but certainly something to keep in mind. Overall, though, when compared to the benefit that was found by taking it, for those felt to be at higher risk for heart disease, it is felt to be worth the risk. This definitely is an individual decision that you need to discuss with your doctor and how this may apply to you. When you look at side effects and risk of medications, it's easy to get worried and not want to take it due to the possibility of something that could happen. And in actuality, this may be the right thing for you. It's important, though, when making these decisions to step back and look at the whole big picture. You have to look at your own individual risks and see why this may be important for you. If you've already had a heart attack, a stroke, or you have diabetes, the data is very clear that being on these medications, if you can tolerate them well, is definitely worth a small risk of problems. If you've not had any of these problems and your doctor is recommending you take it for what we call primary prevention of heart disease, then talk to them about why you think that you are at higher risk. Look at what your risk factors are and talk to your doctor about how you can change those risk factors. If you smoke, quit smoking. If you have a horrible diet and aren't exercising, then make the commitment to make those changes. You can't say that you don't want to take a medication that has known benefits because you think it's going to kill you and still continue to eat garbage, not exercise, and smoke. Well, overall, this is a great medication to treat your cholesterol and decrease your risk of heart attack and stroke. I use it a lot because, as I said before, the side effects tend to be minimal. It has great studies showing that it works, and finally, it's pretty cheap. Luckily, it's generic and you can get it for a good price. In fact, a 30-day supply will run you under $10 in most pharmacies. So if diet and lifestyle changes have not been enough to control your cholesterol and your doctor recommends that you take simvastatin as part of your treatment regimen, hopefully you have a little more confidence in using this as part of your treatment plan. Well, I hope you found this information to be helpful. If so, do me a favor. Go ahead and hit that like button and share it with your friends and family. And if your health is really important to you, consider subscribing and hit that notification button so you don't miss out on any of our future content. Now, don't go anywhere, because if you're looking at ways that you can make that start your diet and lifestyle changes to treat your cholesterol, click here to watch simple steps that you can take to start your diet journey. And click here to watch one of my other videos that can help you in your health journey. Well, until next time, this is Family Med with Dr. Richardson. And remember, take care of your body, because it's the only one you have.